Let's go to our top story today. The health department confirms the fourth case of monkeypox in the Philippines. The patient is a 25-year-old Filipino with no documented travel history from any country that has confirmed cases of the disease. The patient is now in isolation. So far, all four monkeypox cases in the country are unrelated to each other. Let's get more information on this. On the line right now is Health Officer in Charge Undersecretary Maria Rosario Vergeire. Good morning, Yusek Vergeire. Thank you for taking our call.
Yes, good morning, ma'am.
All right, Yusek, the country has detected its fourth case of monkeypox, and what's unique about this patient is this individual has no travel history to countries with monkeypox. This being the case, would you say that we already have local transmission of this viral disease in the country?
Well, we cannot say for now that this is already a local transmission because we are still establishing the source of the infection. The patient apparently denies that he had any relationship or contacts from abroad. So we are still trying to establish and backtrace as to where he got the infection.
So, ma'am, what are the possibilities that there could be more local undetected cases of monkeypox?
Well, the probability is always there because it would depend on the behavior of the person if he will go and seek consult so that we can be able to detect the case. We are not doing actually very active case finding. What we are doing would be intensive surveillance wherein if there are symptoms among those who goes to the health facilities, we immediately detect them, we immediately test them. But for now, we are still continuing this surveillance.
Ma'am, can you talk to us, tell us more about this virus, its characteristics, and the speed by which infection is spread? I mean, we know it's not as transmissible as COVID. So how does one catch it from another individual?
Yes, I'd just like to clarify to our public that this is not the same as COVID-19 because COVID-19 can be spread through the air. This is really transmitted direct contact. So meaning if a person is infected with monkeypox, you sat down beside him and the person has these lesions, you will get that. Also, it can be transmitted through droplet infection. Like for example, the secretions of the persons, if he coughs or if he sneezes or if you kiss, you did intimate contact and you are close to that person, you may get that. But again, it is different from COVID because the COVID can be spread through the air.
All right, so you need to have real close contact with an infected individual. Now, Yusek, if there is indeed local transmission, just hypothetically speaking, when would we expect to see a rise in the number of cases?
Well, if there is local transmission and then the spread would, again, be through direct contact if the person has lesions. Right now, we see that people or the public is already very much aware of the symptoms of this monkeypox because there had been a lot of consults already from the dermatological side or the clinics that we have for dermatology, and also there are also a lot being tested already from our primary care providers. So I think there is heightened awareness and hopefully we can curb this transmission.
All right, and we do expect that we will most likely see more cases of monkeypox in the Philippines in the future. How do you think this will affect the healthcare system, given that even though things are slowly returning back to normal, we are still in a pandemic?
First, it's going, of course, this is additional task for our healthcare workers, but I don't think that it's going to cause that much burden compared to the COVID-19 pandemic or the situation that we have right now. What we just need to do is to really be vigilant, and of course, everybody has to do their share. If they are experiencing symptoms already, they have to initially or seek consult very early.
All right, now we know that face-to-face classes resumed yesterday. There is high mobility with all sectors operating at almost 100%. Ma'am, what measures are in place to prevent the further spread of monkeypox, given that kids are back in school?
Well, whatever we are doing right now as safety protocols for COVID-19 is also effective against monkeypox. We need to always wear our mask. We need to always wash our hands. We need to be vigilant and we need to be very much aware of how this disease is being transmitted. We have assigned safety officers in our schools and all of the other workplaces so that we'll be able to catch those who are feeling sick already and isolate them at once.
Ma'am, do you think there's a need to tighten border security to make sure that monkeypox does not enter the country from other countries?
Well, up until now, the WHO still declares or classifies monkeypox as low to moderate risk, and they do not recommend that any country closes their borders because of this. So we are very much vigilant and doing intensive surveillance, but I don't think that we should recommend the closing of our borders due to this. It is not really a matter of if, but it's a matter of when, if these cases will come in the country. We just need to be vigilant, especially in our communities, do our surveillance, and immediately isolate people who have these symptoms.
Now, speaking of vigilance, I want to talk about vaccines for a moment. The U.S., which is seeing a high number of monkeypox cases, they've already acquired vaccines and have started distributing them to affected areas. Where are we in the Philippines in terms of procurement of monkeypox vaccines? And if and when we get them, how do we intend to distribute them?
Yes, we have already talked to 2 manufacturers of monkeypox vaccines. We are trying to negotiate right now just to have some doses before the end of the year. There is this one manufacturer who have committed that they would be providing us, but only early next year. So what we are doing right now is talk to this specific manufacturer if we can just have 1,000 doses so that we can do ring vaccination. Please remember that we do not do mass vaccination for monkeypox. We are just going to give the vulnerable sectors, and we are prioritizing those who have been exposed and also our healthcare workers.
All right, ma'am, always a pleasure speaking to you. Thank you very much. That was Health Officer in Charge, Undersecretary Maria Rosario Vergeire.